Himalayan Covid-19 Task Force provides free telemedicine services and resources related to COVID-19 and mental health in Nepal, India and the USA in Nepali, Tibetan and English languages. To speak more on the initiative, we have with us the co-founder of the Himalayan Covid-19 Task Force, Dichan Sering. Dichan La, it's lovely to have you on Tibet TV. Welcome to our show.
Thank you, Sakina.
So, Dichan La, how does Himalayan Covid-19 Task Force provide its free helpline services and resources related to COVID-19 and mental health? Dichan La, can you tell us how many of you are involved in this project and how are you all working together in reaching so many people affected with COVID during this time in so many places?
First of all, thank you, Sakina and Tibet TV for hosting me tonight. And Himalayan COVID-19 Task Force, the way we reach the 260 plus people so far in the last 3 weeks that we started the helpline service has been through a lot of partnership with various groups, including grassroots organizations like Sanapaila in Nepal, and also with hiring case managers. So we have hired 5 case managers, one in Nepal, one in Himachal Pradesh, and 3 in Northeast India. As you know, the cases in Sikkim in particular, very dire, very increasing rapidly. And so we felt an urgency there, including Darjeeling and Kalimpong. Through this network of case managers who are linked then to local doctors on the ground who are already working, and through a network of about 16 Tibetan doctors in North America who are providing through WhatsApp, telemedicine and telehealth guidance. And we've been able to reach over 260 plus people. We provide connection to isolation centers at the local sites. And we also work with grassroots nonprofit organizations in these countries where they are actually connected to local groups that let us know how many people are sick and who to connect with.
Dichan La, one of the first and important initiatives of the Himalayan COVID-19 Task Force is the mental health awareness program, which was conducted on so many platforms for the Tibetan and the Himalayan communities. Dichan La, during these interactions, what are the most common concerns regarding mental health in such crisis?
So as you rightly pointed out, last year we did start the mental health telehealth program, and with Dr. Sophia Banu and with Dr. Payton Pinso, who are the task force members. We worked hand in hand with CTA's Department of Health Mental Health Unit and provided online counseling as well as training for counselors and nurses across India. Mental health, the minute you say that, there is a strong stigma in our communities, not just the Tibetan community, but the Himalayan community in general. People were not taking as much of advantage of the helpline that we had created for the mental health. And then gradually, they got more used to it and calls started coming in. But the counselors were faced with a fair amount of dilemma, so to speak, in terms of how to approach this when not as many people were acknowledging that they were having mental health issues, So that's a long-term issue that we're going to have to grapple with in our communities to destigmatize mental health and be willing to acknowledge that that is a disease also that we need to pay attention to. The other concern that was coming up a fair amount is how to address mental health, particularly when it comes in the rural settlements where there are no psychiatrists, where there are no hospitals. Our telehealth program provided our psychiatrists support and counselors. We also partnered with the Tibetan Mental Health Initiative with Dr. Kunga Nonzumla and Dr. Tenzing Delsela.
So, Dichan La, what were the common concerns regarding mental health during these times?
So during the pandemic,
from the people who called you. Okay.
There was a lot of anxiety businesses were closed, so people were anxious about the economic situation. Schools were closed, so children were left without interacting with other kids. Parents having to school teach their children online. A lot of adjustments for everybody. Most importantly, the fear of getting this virus that nobody seemed to know a whole lot about at the time. This was last year when there was no vaccine at the time, and treatment was, far from reality.
Dishinla, Free Tibetan Language COVID-19 Helpline Services, partnering with the Dalek Hospital in Dharamshala, is one of your latest initiatives. So, Dishinla, how many calls do you receive in a day on average? And what are the common concerns that you have been receiving from the people? How are you all doing this?
So for the helpline service, really, it really started with our Nepali partners here. We worked together to figure out the helpline system, hire case managers, link them to a doctor at the local level for the moderate and severe cases, and then for the mild cases and asymptomatic cases, we would link them to volunteer doctors here in the United States and in Canada. So we have a pool of about 37 healthcare providers in North America. Most of them are Tibetans. And then we have 7 local doctors in India and Nepal, and then 7 case managers. There are many calls that we get that are just inquiry calls that don't get actually logged in per se into our Google logging system. Of course, you mentioned the Tibetan Dalek Hospital. We work with them. We also work with the youth response team in Nepal. That is a youth group that came together that work on the ground. They actually are helping the patients get from their homes to an isolation center. We work with the Meta Hope and Challenge group that is actually has an isolation center in partnership with the Snow Lion Foundation of Nepal. And then we also work with other partners like the individual doctors in Sikkim for Dr. Tsering Yugela, Dr. Tsawang Dogala, as well as in Darjeeling with Dr. Dao Bhutia, the Vikram Foundation, and also the Dr. Tashi Namgela. So we have a lot of partnerships, mostly on the grassroots level. The point of the telemedicine, Sakina, is to really reach people who have difficulty accessing health care in the cities.
Since all the information regarding COVID-19 are given for free of cost, and like you have mentioned that there are so many people who are involved in this project, can you tell us how are you managing financially to continue with the initiative?
Yes, thank you for asking, Sakina. I think what we have done is we've launched a GoFundMe crowdfunding appeal with a goal of 62,000. We've passed about half of that through GoFundMe as well as through private donations. We are channeling these through the Tibet Fund. Most importantly, though, I must say, we are able to do the work we are doing primarily because of the volunteer doctors and the doctors on the ground. We have Dr. Rishav, Dr. Nasatya in Nepal. We have, Dr. Tsering Ugel and Dr. Dechen Tsawangla in Sikkim. We have Dr. Bhutia and Dao Bhutia and Dr. Tashi Namgyal. And then in Darjeeling, Kalimpong, and then in Dharamsala, we have Dr. Jamila at the Dalek Hospital. So volunteer doctors here in the US, the 16 volunteer doctors that I mentioned, led by Dr. Sonam Nachatsang and Dr. Dejen Swala, who have been working very closely with me to kind of coordinate all of this from here. And all the volunteers who help us, all of the other doctors and nurses who are in our pool. So when we need more doctors, we can call on them. Our main partner here is also Nisha Thapa, who is a co-founder of Sahayata. So we work very closely together on many of these kinds of initiatives.
So Dishinla, what is the long-term goal in terms of telemedicine, and what kind of challenges do you see in this project?
So Telemedicine, as I had mentioned earlier, it's really the effort to reach people who are having trouble accessing proper healthcare, right? Adequate healthcare. I see a lot of potential in expanding the telemedicine services in our Tibetan diaspora community. We have a lot of settlements that have a small health clinic, don't have a doctor, or some of them don't have a nurse. Through telemedicine, what we're finding here in COVID situation is that we can actually monitor the patient while they're at home with the symptoms, with the mild symptoms, and help them to identify when is the right time to go to the ER. In COVID situation, a lot of people are staying home too long, and then when they get to the hospital, it's too late. Their lungs collapse, and unfortunately, some of them die. And so we would like to be able to prevent that from happening. I think in the long run, we could use Tibetan telemedicine services, hopefully through the CTA and through the Department of Health. So it's cost effective. It has been done. It is still being done. And I think for the Tibetan community in exile and the Himalayan community, we can adopt that at a larger scale, whether it's a pandemic or not. This is a very, an approach that actually works to prevent emergency and high-cost healthcare expenditures.
I must say, Dishanla, that Himalayan COVID-19 Task Force is doing a fantastic job. I would like to thank all the frontliners and also your entire team for this very generous initiative. And I also think that, like you have mentioned, that this initiative should not be there just during the pandemic, but also for the future, because Dishanla, there are so many people who live very far from the healthcare facilities, and this will not provide them with just medical treatment, like online medical treatment, but also medical knowledge, which is also very, very important. Thank you so much, Dishanla, for speaking to Tibet TV. It was lovely doing this conversation with you. Thank you for being with us.
Thank you very much, Sakina, and keep up your good work too.
Thank you, Dishanla. Thank you so much for watching, and see you in the next episode of In Conversation with Tibet TV.